Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us again today. Nearly 2/3 of baby boomer nurses are now considering retirement, according to reports, even as demand for RNs rises quite rapidly. Our guest in studio today is Marsha Faller, Chief Clinical Officer for AMN Healthcare. AMN Healthcare is involved in finding staffing solutions for hospitals and other healthcare facilities. Marsha is here with us today to discuss this coming shortage of nurses. How are you doing today, Marsha?
I'm doing very well, Neal. Thank you.
Thank you so much for joining us today. AMN Healthcare, could you talk about what it is that AMN actually does?
Sure, Neal. AMN Healthcare is the nation's leading healthcare staffing and workforce solutions company. We provide healthcare professionals to the largest and most prestigious healthcare providers in the country, both for contingent and permanent staff. We also provide advanced workforce management programs, which we call workforce solutions. These include managed services programs, or MSP, which take care of all administrative, recruiting, and credentialing responsibilities for part or all of a facility's workforce. And we offer technology-enabled systems for managing your workforce. We now also offer predictive analytics that can forecast a healthcare provider's staffing needs a month or more in advance and then help the provider meet those needs. And finally, we have a superior education delivery program in the Center for the Advancement of Healthcare Professionals.
Now, according to a PRN Newswire press release, it says that nearly 2/3 of baby boomer nurses are now considering retirement, even as the demand for RNs is rapidly rising. Where did this information come from? Which report are we talking about?
Sure. So AMN conducts a survey of registered nurses every other year and has been doing so. This is our fourth semi-annual survey. The report resulting from this survey is titled the 2015 Survey of Registered Nurses, Viewpoints on Retirement, Education, and Emerging Roles. It provides nurses' views on retirement, education, quality of care, and concerns about the nursing profession. The survey was actually sent out early in the year 2015 in the springtime, and responses totaled nearly 9,000 RNs. And the survey is projecting some major changes in the near future, including a timetable and dimensions for a wave of retirements by baby boomer nurses. AMN suspected that this was going to happen, and asking about retirement plans has been part of our survey since the 2010 or 11 timeframe. But in this particular survey, we're seeing that the retirement surge it's been predicted for a while, but it's imminent at this point.
Now, these nurses that are considering retirement, has AMN or any other entity, to your knowledge, considered urging them to become involved heavily in the education of new nurses? Is that something that is addressed in the survey, or even a possibility as far as AMN is concerned?
Well, that's something that is very much talked about within healthcare and in the nursing services areas. One of the big concerns about this retirement cliff that we're approaching is that not only do we lose these older nurses in just the FTE or the position that they're occupying in the work that they're doing, but we also lose their experience and the wisdom that they've gained through years and years of nursing experience. So that's a big concern in terms of how does, kind of the world of healthcare replace not just the position, but all of that wisdom that is lost as well. So there's many things that, organizations are looking at. And in the survey, we looked in particular at, what are nurses planning on doing with their education? Are they willing to and able to be trained to take on some of these new and emerging roles, or learning a new specialty? For example, operating room and labor and delivery are typical specialties with higher ages of nurses. And so making sure that we have enough nurses that we're training and upskilling in those areas to be able to take those positions as the older nurses retire. Those kinds of programs are very important, and the survey found that the younger nurses are interested in those types of training programs. They want to advance their careers, and not just in training programs for, newer, different specialties or new and emerging roles, but also in advancing their academic education as well.
Are we considering nurses that leave the traditional nursing workforce and not necessarily retire, but go to, say, home health or traveling nurses or nursing as a whole?
nursing as a whole, in terms of the aging nurses and what their plans are. So you saw in the survey that, 62% of nurses over 54 were thinking about saying yes or maybe. They were just thinking about retiring in the near future. So that's a large number of nurses. So being able to replace those nurses is one thing, but how can you repurpose those nurses? And that's something else that the industry as a whole is talking about, utilizing those nurses in a different way. They could go into home health, but I think that more likely those nurses are really looking to continue to deliver their wisdom and knowledge in perhaps a shorter shift or part-time work. We did see in the survey that about 21% of those older nurses were definitely interested in moving to part-time work. So it's just, nursing is a profession that it takes a lot out of a person, both mentally and physically. And as nurses age, we want to figure out what are the ways that you can expand and continue that nurse's career so that she or he can continue to deliver that knowledge and wisdom that they've gained over years of experience.
Now, as we wrap up this segment, Marsha, I'd like to ask a question that has to do with nurses that are considering leaving the workforce earlier than age 54. There are many stories and reports of physicians actually changing professions, getting out of the medical profession due to the complexity and uncertainty of the Affordable Care Act. Have you noticed, heard, or read of any instances, or maybe a mindset where nurses are as inundated with information and extra work as far as keeping track of data is concerned, forcing them to consider getting out of the workforce even earlier than 54?
Well, there were a segment of our nurses the younger nurses did indicate that they might be interested in retiring as well or moving into a different type of profession. So I think there is some of that activity going on. We did ask in the survey about the impact of the electronic medical records on a nurse's productivity, their job satisfaction, and whether or not it helps the quality of care for the patients. And we've gotten interesting feedback about that. We also have a lot of qualitative data around the electronic medical records use and nurses' beliefs in terms of it taking away from patient care. And when those kinds of things happen, nurses, tend to want to move into something else that could be more satisfying for them. So similar to the physician, we also work with physicians and get a lot of information regarding them as well. But it's true that what you say about many physicians being dissatisfied with the turn to so much more paperwork to be able to get reimbursement with the advent of ICD-10, the coding system this year, that's become even more onerous for them. So yeah, I think we're seeing a similar type of a perception or a feeling in the nursing as we do in the physician.
Where can our listeners get more information about AMN Healthcare and possibly review this survey for themselves?
So the survey is available on the AMN Healthcare website, and that is at AMN Healthcare, www.amnhealthcare.com, and all the information about AMN Healthcare and access to the survey is right there.
Thank you very much. You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio this afternoon speaking with Marsha Faller, PhD and a registered nurse. In addition to that, she's Chief Clinical Officer for AMN Healthcare. They're involved heavily in staffing solutions for the upcoming surge of nurses who are considering retiring as the need for nurses rises. It's been great having you here with us today, Marsha.
Thank you so much, Neal.
Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.